colleagues, esteemed faculty, dear delegates and students, very good morning to all of you. And today I am Singh, and this will be Diana Ramsar, and we will be delighted to be your anchors for the session 1 of today's day.
Very first session of the conference and this exciting day ahead of us. This first session promises to inspire and ignite curiosity, setting the tone for an amazing day ahead, filled with learning and sharing the passion of science and health with one another.
So take a deep breath, settle in and get ready, because today's morning is going to be all about insights, inspiration and ideas that will blow your mind.
And to guide us through this session with their wisdom and expertise, we are honored to have two esteemed chairs with us today.
It's my privilege to introduce the first chair for today's session. We are honored to have with us Professor Dr. Singh, the Principal of SSR Medical College and Head of Department Anatomy. With over 33 years of dedicated teaching experience, Sir has shaped the careers of countless medical students and inspires us through his vast knowledge, academic leadership, and unwavering commitment to education. As his students, we have experienced his first-hand guidance, encouragement, and passion for teaching, which truly makes him an exceptional academic. I now invite Professor Dr. Singh to kindly take his chair. Ladies and gentlemen, let's give him a big hand.
It is my pleasure to introduce our second chair for today's session, Dr. Kant Mishra. Dr. Mishra is a senior consultant in internal medicine at Welkin Hospital and has been serving so for 16 years now. Prior to this, he contributed significantly to public health as a specialist and later senior specialist in medicine with the Ministry of Health of Mauritius from 2002 to 2011. Earlier in his career, he gained extensive clinical experience as a senior registrar in medicine at Welkin Medical College, South Darjeeling Hospital and TDU Hospital in New Delhi. He is also a life member of the vast experience, deep knowledge, and dedication to patient care. We are truly honored to have Dr. Mishra as the second chair for this session. May I now invite Dr. Mishra to kindly take the seat and a big round of applause for him.
Ladies and gentlemen, it is my great pleasure to introduce the keynote speaker for today's first session. We are honored to welcome back Professor Dr. Hausenloy, who last visited our college 2 years back for a similar conference. It's wonderful to have him with us again. And if I may add, he seems to have discovered the secret of river sailing because he looks even more energetic at the end of this time. So, Professor is a distinguished researcher and academic. He's a professor in cardiovascular and metabolic disorder programs at Duke Medical School, Singapore. He is also a professor at the Institute of Cardiovascular Sciences, University College London. He currently serves as the director of the National Heart Research Institute, Singapore. His academic achievements are truly outstanding. Over 338 peer-reviewed publications, supervision of 11 PhD students and 16 MD students, and a research grant income exceeding $17 million as principal investigator. His pioneering work has advanced the field of cardioprotection and cardiac imaging worldwide. Today he will share his insights on the topic cardiac MRI in acute myocardial infarction. The closer you look, the more you see. Professor, we are delighted to welcome you once again. May I now please invite you to the podium with a round of applause.
Good morning again, and again I'd like to thank Professor Singh and Professor Banerjee for the kind invite to speak here today. As I said, it's great to be back at this meeting, and I want to congratulate the organizers on this excellent meeting. So, as I said, I'm a cardiologist in Singapore. I was previously in the UK University College London, and I do basic science and clinical research in the areas of ischemic heart disease and heart failure. But because there's mainly addressing medical students today, I will mainly focus on clinical talk, like MRI, but also some of the clinical research cardiology, but as all major specialties, you have subspecialties. And my subspecialty is cardiac imaging, and even within cardiac imaging, my specialty was cardiac MRI. So I will share on some of the research as well as the clinical application of cardiac MRI. And I'm chosen to speak on acute myocardial infarction because this is the area of my research interest. Cardiac protection means protecting the heart from ischemic perfusion injury, reducing the damage to the heart to prevent heart failure. As you know, ischemic heart disease and heart failure are the leading causes of death and disability worldwide, and new treatments are needed to try and protect the heart to prevent heart failure, and cardiac MRI can really help in this regard. And the reason I say it's the closer you look, the more you see, is that among all the cardiac imaging modalities such as echocardiography, CT, X-ray, the cardiac MRI really allows you to image the myocardial tissue in exquisite detail, and you can get lots of information by using MRI in this regard. So I'll divide the talk into 3 parts. First, the role of cardiac MRI in acute myocardial infarction. Second, how we can use cardiac MRI to assess new treatments for protecting the heart during a heart attack. And in the third, I'll talk about some new cardiac MRI approaches in acute myocardial infarction. And as expected, since AI is applied to everything now, there will be some AI application in these last few slides. So I think we're all familiar with acute myocardial infarction as one of the leading causes of death and disability worldwide. And due to our aging population, increasing cardiovascular disease risk factors, I'm sure Singh here in Mauritius, as in Singapore, we have increasing prevalence of risk factors such as diabetes and heart attack. You can reduce heart attack, you can reduce the morbidity of heart failure. So new treatments are needed to reduce infarctions, which is the damage to the heart, and prevent heart failure after heart attack. And of course, for those of you, we divide heart attacks into end-STEMI and STEMI, is a non-ST elevation myocardial infarction or ST elevation myocardial infarction. And the reason for bringing up 2 different types is that cardiac MRI application for these 2 different types of MRI are different. So as you know, a STEMI is diagnosed mainly with ECG, and patients have a complete occlusion or complete blockage. And for those patients, the treatment is urgent primary angioplasty. Whereas patients presenting with a non-ST elevation MI, where you have a partial occlusion of the coronary artery, and those patients, when they're admitted, usually have medical treatment, and then of course our cardiology colleagues will then do an angiogram during their inpatient admission. And we can use cardiac MRI for different reasons for these 2 different groups of patients. So that's why I'm bringing up STEMI and end-STEMI. So this slide shows a typical patient presenting with a left coronary artery occlusion. So this is a patient having an angiogram who's coming with a heart attack. And this is the left main coronary artery, and you can see this is occluded here. And of course, our cardiology colleagues, interventionists, will put a catheter into the left coronary artery, put an angioplasty balloon, open up the artery, put a stent in to keep the artery open, and then you see you have a nice open artery. So from the cardiology point of view, they've done their job. The patient's heart attack has been aborted, the patient is now pain-free, but the damage to the heart has already been done.